So it's important to look into how far the surgery may be or where the surgery is going to be performed from your hometown or your location, because you also have to understand that after surgeries, you want to see if that hospital will keep you for a certain amount of time. Some hospitals won't keep you for a long time, which means that you have to go back home to your support system. Housing, that's very important. So travel time is important. Will you be able to sit down, right? So thinking about that, when you travel, you have to sit down. Do you have someone that's going to drive you? Are you driving by yourself? Or you have an Uber? Like whatever those transportation details look like, you want to evaluate that and your pain level and comfort. Hospitals won't discharge you where they know that you are unable to at least manage. However, pain shows up anytime it wants to. It's a part of the nerve system in your body. So be clear on the distance.
In terms of accessing surgery, given having a hard time, just any medical procedure, sort of sorting through all this information, sorting through all these different sort of care systems of the surgeon, your primary care office, the hospital, the insurance, in the midst of all of that, you're also trying to figure out, what's best for me, really? Like in an ideal world, what would I want and what should I have access to? And so understanding that, and also understanding what a actually wide variety of procedures there are out there, can really put us as trans and gender non-binary people in a really sticky situation of like, oh my gosh, how do I know what the best procedure is for me?
Is your goal to be able to pee standing up? That's going to influence the type of surgery that you have. Is your goal to be able to have receptive vaginal sex? That's going to influence the type of surgery that you have. There's a lot of people now who want sort of vulvoplasty or a zero-depth vaginoplasty, and so having a conversation around that as a potential option can help avoid a lot of complications. And, is the most important thing a low chance of complications? Is the most important thing to have, a peritoneum vaginoplasty?
There are, subcategories. You can think of it as like top, anything that's kind of above the belt. Then there is bottom surgeries, things that are kind of below the belt. But there's a lot of body parts that you're kind of dealing with, and there's a lot of variation, right? There's been a lot of changes to surgeries and the technology over the years, and so that means that there's a lot more choice. So with top surgery alone, there's 6 different procedures that one could possibly get based on your weight, based on the amount of breast tissue that you might have. If you're someone that's getting lower surgery, let's say you want to get a hysterectomy. Do you want to get a full total hysterectomy, or do you just want a oophorectomy, or just the hysterectomy itself, and not the ovaries and the fallopian tubes? And if you're going to get a phalloplasty, are you going to get a vaginectomy, which is the removal of the opening or the closing? I'll put it this way: a vaginectomy is essentially the removal of the opening of your vagina, right? And that's usually considered a requirement for phalloplasty, but it doesn't have to be, right? So knowing what your options are based on your sexual, practices and how you like to have sex, how you know your body to be, those are all things that are actually a choice. And you actually have more choices than you think. So knowing what is involved and how many different pieces are involved with the surgery is really important, because you're not just going to go get a phalloplasty that's all staged out. You have to get multiple procedures over a period of time. If you get facial feminization, it's not your entire face one day. You might just get a rhinoplasty, or maybe you have other parts or sections of your face that are focused on, and that all depends on what you're most dysphoric about and what makes most sense for you. So it's important to know that you actually have the opportunity to talk to your surgeons about that. And if they don't have the ability to do that, then you want to do more research to see who can, and then how to kind of manage that process.
There's a lot of information and misinformation out there that patients may have heard about. Some people may found out that a certain top surgery procedure, the results is not something that they want, or it scares them, or it upsets them that this is the result of their top surgery process. So it's important to know and understand in advance what surgery might look like afterwards.
On top of the variety of procedures that you can get, it is important to know like what you can actually qualify for, which is kind of a strange way to think about it, because it's like, you qualify for half off for, this car, but you are buying something, right? This is a purchase in a way, right? And I don't want to break it down in such a funny or, in a way that takes the meaning out of it. But sometimes when you want to simplify a concept for someone, like talking to my mother about this, for instance, about my need for surgery and how to kind of manage it. Sometimes you do break it down to the simplest, most base moments, which is good and bad. But like sometimes you think about it this way: it's like it's a big investment, right? So if you decide to go to school, like you might need to take out loans and all this other stuff, but what does it mean for you in the long run? Those are all things that you want to consider like financially around this. But when it comes down to knowing the procedure and who's available to you and who's going to pay for it, those are all very different based on the procedure you're getting, the surgeon that you're going to go to, and where you live. So there's nothing that's exact at all. There's literally nothing that's exact about accessing surgery today in New York State, or in New York City for that matter, because standards of care are quite different. Insurance policies tend to vary quite a bit, as well as the policies that you need to follow in order to get the specific procedure that you need to get. So it's all dependent on the circumstances.
Other forms of medicine, the end receiver isn't as expected to be all that engaged in like what different kinds of techniques are out there. In trans surgery, it's a tough road, but we have to really be critically engaged with our surgical teams to understand that there are a lot of different options out there and to figure out what's going to be the best for you. Here at Callen-Lorde, we're absolutely trying to develop more resources to guide people through what those different medical procedures are and really lay out the full course of options for people. But what I tell every person who talks to me is like, look, talk to multiple surgeons. Even if you absolutely love the first person you meet with and you get along great with them and you've got a great understanding and you're on the same page about what you're going to do in terms of a procedure, talking to a second surgeon, you'll hear just even a slightly different set of viewpoints on the same questions, because everyone's training is a little bit different. Everyone's experience in terms of what they've tried and how it's gone in their hands is a little bit different. And so even if you end up going to that first surgeon, it'll still give you like a new perspective of different questions to ask about the same procedures. And sometimes you'll find that two surgeons have very different answers to the same questions. It doesn't necessarily mean that one is right and one is wrong. Although we also, you don't want to go to 9 people and then the 10th person says yes, and finally someone said yes to you. Some things might not be just as achievable as we would want them to be. At the same time, it is not unusual for 2 surgeons to have different opinions about the same thing, and it's more of finding someone who's willing to match your goals and work with you with the techniques that they do have access to safely meet your goals. I just encourage people to take advantage of the waiting lists and these periods of having to prepare for surgery to really make sure you're getting the best surgery for you. You have the opportunity to do that. It can be difficult to sort through a lot of the information, and sometimes you'll hear different answers from different people, but it's important to ask the questions and to get a sense of what's out there.
Like, do your own homework, your own research, and then double check with your surgeon, with your medical provider, like, is this the way that you do it? Like, there are a lot of different techniques to every single surgery. Like, how do you do it? What can I expect is going to happen? Drains, catheters, what medications are you going to prescribe for me? What can I expect in my recovery? Like, how long would you expect I'm going to have these drains in or catheter? You know, again, like do your own research. People are awesome at sharing information, and then confirm with your surgeon, you know, if that is really the case for that surgeon, and you know, from their experience and from having worked with a lot of other people, like, is that their experience with that particular surgeon?
I think each person's body image is unique, and there are no two individuals that have the same body or the same goals with regard to both form and function. And so I think we try to talk to our patients about what they would like their surgery to, what their goals for surgery are, what their aesthetic is, because not everyone's aesthetic is the same, and try to understand that and really translate that for them.
There are a lot of different personal goals that can be met through surgery. You know, there's no such thing as like one perfect female or male body, and certainly no perfect trans person's body. We all carry in our own goals and our own ideas of what the best is. And so in light of that, you want to find someone who's a good match with you and your goals.